I'm Kristin Pettit. I am at the University of Chicago. I've been here for 5 years now. I'm a clinical oncology fellow at the University of Chicago, and I'm also in the clinical pharmacology program here, and through that I'm working in the laboratory of Dr. Eileen Dolan. So I was born in a small town in Illinois, rural Illinois. Most people stay in that town and don't move to the city or go other places for the most part. But I always really liked science a lot. I always liked big university settings, those sorts of things. So I unfortunately lost my dad when I was young. I was 8 years old when my dad passed away. And I think that was what first kind of sparked my interest in medicine in general. Then going through science classes growing up and in college, I really started liking cancer biology. So I chose to go into the field of oncology, cancer medicine. My primary goal was always to treat patients, which is what I'm doing. I'm treating primarily adults with leukemia right now. But as I got further along in the field and realized how many questions there were still to be answered, I got more and more interested in the research side of medicine too. So I joined a laboratory, Dr. Dolan's lab here at University of Chicago, to help study differences in responses that people have to different drugs. So I'm really interested in why some people will respond to one leukemia drug while other patients with the same disease won't respond as well. They'll still have leukemia after they get the drug, while other people's leukemia will respond well. So that's what I'm working on doing here in the lab with Dr. Dolan. It wasn't super creative, but I was able to come up with creative ways to solve problems when I had something focused, but I was never particularly like artsy or that side of creativity. So I think it helps a lot. I mean, that's what we do on a day-to-day basis, is try to think of new ways to solve problems that have been around for a long time, or think of other problems that are out there that need creative solutions. So I think being able to kind of think outside the box really helps a lot. One of the primary goals in the Dolan lab in general is to figure out ways to further the field of precision medicine. So what that means is figuring out what drug is going to be right for each particular patient. Not everyone is going to have the same responses to a particular medication, like a chemotherapy for cancer. One thing that the Dolan lab is trying to figure out primarily is why that is, usually on a genetic basis. If there's any genetic reason why one person is going to respond to a drug or going to get sick from a drug, whereas another person wouldn't. Because if you can figure that out, then you might be able to test people in advance and figure out whether a drug is going to be good for them or whether it's going to be harmful for them. And doctors can make their decisions based on that when you're treating patients with cancer. My particular project that I'm working on is with the most common type of leukemia called CLL is what it's called. There have been a lot of huge advances in that type of leukemia over the last 2 or 3 years. There have been a couple new drugs approved, but not everyone responds to them. So one thing that we're trying to figure out in the lab is if we can find ways to predict, looking at people's genes, who's going to respond to these drugs and who's not. Because if you know that up front, then you can save patients a lot of time and a lot of potential side effects by choosing a different drug for them or choosing a different dose or something like that. So this is I think it's a great field. Medicine, research, from any perspective, whether you're treating patients, whether you're doing clinical research on patients, or whether you're doing laboratory-based research, I think they're all fantastic fields. They're extremely rewarding personally to know that everything that you're doing on a day-to-day basis is actually going to pay off and help people live longer or live better or have better treatments in the future. It's really a good feeling to know that that's what you're doing with your life and with your time. One piece of advice would be to ask lots of questions. People like to share their stories and their opinions, so always be asking questions of people who have kind of gone before you down the roads that you're thinking about going down, and ask them how their path has been. You can learn a lot from people's experiences before you, and people love to talk about it.
you.